Flexion injury. This is the commonest spinal injury examples. Heavy blow across the shoulder by a heavy object, fall from the height on the heels or the buttocks. This is the pictures in flexion injury, and we can see in this diagram injury mechanism. Result in the cervical spine, a flexion force can result in sprain of the ligaments and muscles of the back of the neck, compression fracture of the vertebral body C5 to C7, and the third is dislocation of the vertebra over the another common C5 and C6 dorsolateral spine. This force can result in the wedge compression of a vertebra. L1 commonest followed by L2 and D12. It is a stable injury if compression of the vertebra less than 50% of the posterior height. Now the next one is the flexion rotational injury. This is the worst type of spinal injury because it leaves a highly unstable spine and associated with a high incidence of neurological damage. For example, heavy blow onto one shoulder causing the trunk to be in flexion and rotation to the opposite side, a blow or fall on posterolateral aspect of the head. Result in the cervical spine, this force can result in dislocation of the facet joints on one or both sides, fracture dislocations of the cervical vertebra. In the dorsolumbar spine, this force can result in a fracture dislocation of the spine. Here, one vertebra is twisted off in front of the one below it, while dislocating the upper vertebra takes a slice of the body of the lower vertebra with it. There is extensive damage to the neural arch and posterior ligament complex. It is a highly unstable injury. Vertical compression injury is a common spinal injury example. Blow on the top of the head by some object on the head, a fall from height in the erect position result in the cervical spine. This force result in a burst fracture. The vertebral body is crushed. This is the diagram of the vertical compression injury.